This is the MCQ test on the autonomic nervous system. And the first question is, drug of choice in the treatment of anaphylactic shock is, and the options are adrenaline, noradrenaline, dopamine, and isoprenaline. Question 2. Which of the following drug or drugs block the uptake 1 of catecholamines? And the options are cocaine, atropine, pilocarpine, corticosterone. Question 3. Dell's vasomotor reversal is observed with noradrenaline, adrenaline, isoprenaline, dopamine. Question 4. Which of the following sympathomimetic drug is used as a nasal decongestant? Oxymetazoline, amphetamine, salbutamol, terbutaline. Question 5. A 45-year-old male farmer was found confused after exposure to the insecticide in the field, and since then he lost consciousness. His heart rate is 45 per minute and his blood pressure is 80 by 40 mm of Hg. He is sweating and salivating profusely. Which of the following agent is indicated? And the options are physostigmine, norepinephrine, neostigmine, and atropine. Question 6. Preferred alpha blocker for the long-term control of blood pressure in inoperable cases of pheochromocytoma is? Options are yohimbine, prazosin, phentolamine, and phenoxybenzamine. Question 7. Propranolol is contraindicated in all of the following conditions except bronchial asthma, migraine, heart block, and Raynaud's disease. Question 8. Which of the following drug is not a cardioselective beta blocker? And the options are esmolol, timolol, atenolol, and metoprolol. Question 9. Activation of the beta 2 adrenergic receptors results in all of the following effects except bronchodilation, skeletal muscle vasodilation, renin release, and glycogenolysis. Question 10. Which of the following may precipitate an acute attack of glaucoma if instilled into the eye? Latanoprost, atropine, pilocarpine, and brimonidine. Question 11. Drug of first choice for treatment of open-angle glaucoma is timolol, apraclonidine, acetazolamide, and pilocarpine. 12. Which one of the following is the preferred anticholinergic drug for the treatment of peptic ulcer? And the options are atropine, dicyclomine, pyrazapine, and flavoxate. Question 13. Which of the following agent or agents inhibits the release of acetylcholine from cholinergic nerve endings? And the options are botulinum toxin, atropine, black widow spider toxin, and hemicoline. Then question 14. Find the incorrect statement. Physostigmine is poorly absorbed orally as compared to neostigmine. Neostigmine is having better corneal penetration as compared to physostigmine. Physostigmine is naturally derived while neostigmine is synthetic. And neostigmine is preferred over physostigmine in case of myasthenia gravis. Question 15. Preferred agent for the diagnosis of refractory error in an adult is atropine, hometropine, cyclopentolate, and tropicamide. Question 16. A rise in the systolic and marked fall in the diastolic blood pressure is seen with adrenaline, noradrenaline, isoprenaline, and all of the above. Question 17. Which of the following pharmacological action of dopamine is prominent at the dose range of 3 microgram per kg per minute? Increase in heart rate, renal vasodilation, increase in force of contraction of heart, and significant rise in blood pressure. Question 18. In which dilution adrenaline is used with the lignocaine or any other local anesthetic for nerve block? 1 is to 1000, 1 is to 10,000, 1 is to 50,000, and 1 is to 1 lakh. Question 19. Select the correct statement regarding the treatment of benign hypertrophy of prostate. And the options are: finasteride targets dynamic component while prazosin targets static component. B. Symptomatic relief is achieved earlier with finasteride as compared to prazosin. C. Prazosin is preferred over tamsulosin as alpha blocker in the treatment of BPH. And option D. Terazosin has additional apoptosis promoting effect on prostate. And question 20. Following are the advantages of cardioselective beta blockers or non-selective one, except less interference with the carbohydrate metabolism, effective in suppressing essential tremor, less liable to impair exercise capacity, and less tendency to cause bronchoconstriction. Okay, so these are the 20 questions and you will be provided 20 minutes for it. Thank you very much. In next session we will discuss the answer of these questions.